Many people come to clinic and ask whether they may have a food allergy. And clearly, if you have symptoms, if your gut hurts, or if you get loose stool, or if you have other symptoms when you eat, one of the first questions you might think is, am I allergic to that food? But I think it's really important to differentiate between a food allergy and a food intolerance. Allergy, in medical terms, is a very specific thing. It's an immune reaction against aspects of the food, normally proteins within the food. There are some very classic examples of food allergies. Some people get significant reactions, for example, to peanuts or shellfish, a sort of anaphylactic shock. That is an immune reaction to those foodstuffs. Also, celiac disease. That's an immune reaction of the immune cells that line the gut to one of the proteins that is contained within the gluten component of the food that we eat, and so people with celiac disease go on a gluten-free diet. But that doesn't mean that every time someone gets symptoms from what they eat, it's actually an allergic reaction. And of course, the food that we eat can very much give us symptoms in the bowel. If we eat too many fermentable carbohydrates, we may get bloating, we may get loose stool, and we may get wind. That's what we know. If you eat baked beans, you pass a lot of wind. Now, if you're particularly sensitive to the development of that gas, that process, the normal process, which is fermentation, you may feel that when you eat certain foods, you always get symptoms. But that's not an allergy, that's an intolerance. But clearly, if you are having symptoms when you eat, it's important to get some advice to try and differentiate between the two. Some things may need food avoidance or treatment for the allergy. Others may need dietary advice so that you can avoid foods that cause the intolerance.